I was in a car accident in 1986. That's what started all this. Had broken my femur. I had nerve damage to both my knees. I had seen some other doctors and they said, well, you need your knee replaced eventually, but you're too young to do this. And so I just kept dealing with the pain for years.
We like to think about people that are young, people that are active, even older people that are active, people that could wear out a knee in 10 or 15 years. They'd be a perfect candidate for this.
I have a 30-year knee, so it's going to last me longer. I'm not going to have surgery in 10 to 12 years.
When we do a knee replacement, we remove a portion of bone off the end of the thigh bone. And in the normal knee replacement, normal is everything up until now, that's been replaced with a piece of metal made out of cobalt chrome. Then a piece of bone is removed off the shin bone, and a metal tray with a plastic liner is inserted. And that is the bearing surface, this metal against that plastic liner. And historically, that's always been what a knee replacement is. The problem is with this is that wear particles are generated. There's some wear in between that metal and that plastic, and that can lead to loosening of the knee somewhere between 10 to 15 years later. Implant manufacturers and doctors have been looking for ways to improve the wear, and the first thing that has been done is this plastic has been modified. It's a chemical process called cross-linking that makes it very dense and very firm, and it makes it much slicker and reduces the wear. And a lot of companies have that, but the new knee that we're talking about today used a whole different metal on the thigh bone side, and it's a black shiny metal called zirconium, and it's been treated to make it into a metal called oxinium. And when we couple that metal against that special plastic, the wear rate is almost negligible at 30 years.
2 weeks and 1 day today since I had the surgery, and I'm doing fine. I'm having quite a bit of swelling, but they said that's normal.
The surgery is much like regular knee replacements in the sense that the metal is just changed, so the surgery lasts for 45 minutes. Patients are in the hospital for 3 days and then home, and we like to say they're tickled to death at 3 months.
I want to go back to work, but one thing I've always wanted to do again was to dance. And so that's one of my goals, is I want to be able to go dancing again.